Our final presenter will be Jean Mendoza. Jean is the Executive Director for the Friends of Toppenish Creek, or FOTC, a 501c3 nonprofit group located in the Yakima Reservation in South Central Washington State. She is a master's prepared registered nurse, retired, with a graduate studies in public health and policy. Her area of expertise is air and water pollution from concentrated animal feed operations. She served for 7 years on the Lower Yakima Valley Groundwater Management Area Advisory Committee, addressing groundwater problems. FOTC conducts air and water research with funding from the Columbia River Keepers and the Yakima Nation. Ms. Mendoza participates in community engagement regarding air pollution in Yakima County, Washington, where levels of fine particulate matter are high due to ammonia emissions from industrial dairies. Through FOTC, she encourages and assists the Washington State Department of Ecology and the Yakima Regional Clean Air Agency to better protect the health of the multicultural communities that share the Yakima Valley. She has served on the YRCAA Agricultural Task Force and the YRCAA Dairy Work Group. She has testified before the legislature on environmental justice. She informs the public and policymakers about EJ at ground level and helps the victims of pollution to access assistance. Jean, thank you for being here, and take it away.
Since 2010, I've been the executive director for the Friends of Toppenish Creek, a nonprofit group dedicated to addressing the abuses of industrial agriculture in the Lower Yakima Valley. Friends of Toppenish Creek is interested in PFAS because 17% of the biosolids/sewage sludge from King County, population 2.3 million, is trucked to what we call the Lower Yakima Valley and spread on cropland. The sewage sludge and biosolids are not tested for PFAS. Next slide, please. So let me orient you to where I come from. This is just a bird's eye view from one small community regarding PFAS. There's a circle around the Yakima River basin here. The Yakima River feeds into the Columbia River just east of the red star on the map here. And that red star is the location of the Lower Yakima Valley where I live. This is an area that's intensely irrigated. We are almost entirely dependent on agriculture for our economy. We're a gun-toting, fish-eating people. If you look close at the map, you can see where the Washington State Department of Ecology has tested surface water, fish tissue, and osprey eggs for PFAS. You'll see that throughout the central region of Washington State, the Department of Ecology has done no testing for PFAS whatsoever. I believe that this is intentional, and I'll try to explain to you why I believe that has happened. This is important to us for a number of reasons, but one of the reasons is that PFAS is a forever chemical. And when it's applied to the land, it stays there for a long time. So there are at least 3 dairies across the nation that have closed down because of PFAS on their soils, in their crops, that went into the feed that was fed to the cows and ended up in the milk that could no longer be sold because of high PFAS levels. So for the Yakima Valley, it's a concern when all these biosolids are being put on our land. Are they accumulating, and are they affecting the crops that we rely on? Next slide, please. So I expect that you're all familiar with the county health rankings. Yakima County ranks 34th out of 39 for health outcomes in Washington State. We rank 38th out of 39 for health factors. The numbers are worse for the Lower Yakima Valley because the population here is younger with a lower income and less education. The Lower Yakima Valley population outside the Yakima Indian Reservation is over 70% Latino. And this surge in population has occurred over the last 30 years. In my opinion, Washington state government neglects the people of Yakima County, and I'm happy to provide evidence to support this assertion. Washington law requires the Department of Ecology to land apply biosolids to the greatest extent possible. So that's written into our statutes. What that means is biosolids need to be put onto cropland. That's the only beneficial use that ecology has been able to devise for these biosolids. The Yakima Health District receives a fee payment for every ton of biosolids that is applied to Yakima Valley cropland. Go on to the next slide, please. So this is just a snapshot of the health issues that we have in Yakima County. We have very high rates of asthma hospitalization, very high rates for myocardial infarction, high rates for low birth weight. And interestingly and importantly, we have low rates for cancer. Next slide, please. And this is just a review, a listing of the known problems related to PFAS. I just put this up here to remind people. Next slide, please. So this is an incomplete chart that I put together to try to explain the multiple exposures that people in the Lower Yakima Valley are exposed to. So across the top are the problems related to PFAS. Then we have the major PFAS chemicals with the health problems that are related to them. Below that, we have air pollution, volatile organic compounds, nitrates in drinking water, persistent bioaccumulative toxins, including dioxins and furans, pesticides. The bottom two pesticides are legacy pesticides. So people are surprised that we still have a DDT problem. But DDT is still in the soil here, so people are still exposed to DDT. Most people think of VOCs as related to the petroleum industry. In the Lower Yakima Valley, we have a third of all the dairy cows in Washington state. We have them on confined animal feeding operations. So in essence, we have a city of 2 million people, or the equivalent of the waste from a city of 2 million people and no sewage system. This is related to the dairy cows that are concentrated so heavily in the Lower Yakima Valley. And dairy cows emit VOCs. So this is a listing of some of the VOCs that come from the dairy industry. My point in putting this chart before you is that we cannot say that any of our health problems are attributed to any one pollutant because we have so many pollutants here in the Yakima Valley. Next slide, please. Yakima County has the worst air quality in Washington state. We have a severe problem with water pollution. We have some of the highest nitrate readings in the nation. So for those who are not familiar with the issue, very often water pollution is measured by nitrate in drinking water. We have one monitoring well in the Lower Yakima Valley with nitrate readings above 200 milligrams per liter. We also have poverty, pesticides, and as I said, PBTs such as dioxins and furans. Next slide, please. So I've tried to answer some of the questions that the panel has posed here. So what is the value to our community to testing individuals for PFAS right now? Surveys in our community say that people are most concerned about air pollution, water pollution, and pesticides. But as a group, we have a number of severe social problems. We have the highest homicide rate in Washington State. We have almost 3 times as many COVID deaths as the rest of the state. High rate of homelessness, and we're near the Hanford Nuclear Reservation. My point in bringing this up to you is that individual people, individual families worry much more about these issues than they do about something like PFAS that they don't understand very well. Next slide, please. I think data is always important. We pay lip service to scientific studies over here, but very often in Yakima County, scientific evidence is suppressed. Some of our leaders don't want to worry people. Some of our leaders say, well, if we do the study and if we find the problem, then we have to do something about it. So in a sense, some of our leaders kind of believe that ignorance is bliss. In Yakima County, the Yakima Health District is pretty much controlled by the county commissioners. And our county commissioners focus heavily on business. Their belief is that if we have a thriving economy, people will have jobs and people will overall do better. So in our county, at least, business takes precedence over public health. This is a fact. The Yakima Health District does not acknowledge the dangers from nitrate water pollution. There's nothing on the Yakima Health District website that talks about nitrates. They do not issue bulletins and they do not do the research related to it. Next slide, please. So this is a 2020 picture from one of the hills overlooking the lower Yakima Valley. This is not cropland. This is kind of a barren place that a lot of people think is readily available for disposing of waste. So this is a picture of biosolids from King County that was stockpiled in this area. There was just a need to stockpile the sewage sludge for a period of time until they could find out where to put it. And after a while, it was moved someplace else. From the Friends of Toppenish Creek's point of view, we are a dumping ground for waste from the west side of the state. We believe that this will harm the air and the water and the soil in the Yakima Valley. Next slide, please. The challenges that I think face health professionals include the fact that many people in my community don't understand epidemiology or risk assessment. There are a lot of poor people in our community, and very often poor people here live day to day. The challenge from day to day is to get enough gas money to do what people need to do. It's kind of unrealistic for some poor people to plan far enough ahead to think about what PFAS is going to do to their quality of life 20 years from now. The clinicians in Yakima County don't receive any support from the local health district regarding PFAS. We had a health officer who in 2018 introduced the idea of PFAS to the Yakima Health District, to their board of directors. That was the last time anybody at the health district heard about PFAS until last fall, when I asked the Board of Health to look at PFAS, they dismissed my request, and they have not addressed PFAS since then, and they have not communicated with me about PFAS. Next slide, please.
I'm hoping, Jean, you can kind of wrap up.
I certainly can. Let's just go on to the very last slide. Okay, these are my personal recommendations. I think clinicians need to get information through their professional organizations. I do not believe that the Yakima Health District is willing or able to educate local healthcare providers about PFAS. Do support biomonitoring if it's done in the context of multiple exposures and multiple pollutions. Believe very strongly that fish should be tested. We are fish eaters, and the fish in the Yakima River are already polluted with other contaminants. If I have any influence at all, I would support a moratorium on spreading sewage sludge and biosolids on cropland until there is adequate testing of that biosolids so the farmers know what they're putting on their land. Thank you.